Hello and welcome to Single Payer Radio. I'm Paul Hoppy, broadcasting from the Hayburn Building in Louisville on the WFMP 106.5 Forward Radio Community Network. Our programs air every Monday at 2 p.m., Tuesday at 7 a.m., and Wednesday at 11 a.m. And we also stream our show on SoundCloud so you can listen anytime. The show is a project of Kentuckians for Single Payer Healthcare in conjunction with Physicians for a National Health Program through its Kentucky chapter. We produce this program because we believe healthcare is a human right. We advocate for a national, not-for-profit, publicly funded, single-payer healthcare system that works for everyone. The views and opinions expressed on our show are those of the speakers and not the station. Our station relies on volunteers like myself and your ideas and donations to keep us on the air. Now, let's get started.
Welcome to Single Payer Radio. My name is Kay Tillow, and I'm chair of Kentuckians for Single Payer Healthcare. We are a Kentucky organization working to enact an improved Medicare for all, a national single payer plan that would cover everyone in the country without copays, without deductibles, with no barriers to care, and would allow everyone to choose their physician and their hospital, and would assure that no one is left out of the magnificent healthcare that this country has to offer. Today, we are going to be discussing a National Day of Action scheduled for Saturday, May 31, 2025, this year, to put the force of organization and mobilization of the people behind this idea and to be working to enact such legislation. So I'm joined by four other people who are activists within Kentuckians for Single Payer Healthcare, and I'll let them introduce themselves. Katrina?
I'm Dr. Katrina Kerfoot. I am a board-certified family practice physician who served for a decade at a federally qualified community health center in Louisville, Kentucky, and that's when I became interested in this issue. I'm currently licensed in Kentucky and New York and Florida doing telemedicine.
And Charlie?
I'm Charlie Casper. I'm treasurer of Kentucky for Single Payer Healthcare, and I've been a member of the organization for 11 years plus.
Amber?
I'm a community member in Bowling Green, Kentucky, and an advocate for single payer.
And Paul?
I'm Paul Hoppy, and I'm the producer of Single Payer Radio, and I've been interested in single payer healthcare for many years. I've been with this group for 4 years.
And we produce single payer radio shows thanks to the work of Paul Hoppy and of two retired surgeons, Drs. Mike Flynn and Dr. Eugene Shively, who normally do the interviews for our program. But this program is about the National Day of Action. It's called For Health, Not Profit, to put national single payer on the nation's agenda. So that activity has been planned for a couple of months now, and we in Kentucky have scheduled our rally to take place on Saturday, May 31 at 11 a.m. at the Mazzoli Federal Building. And that is at 600 Martin Luther King Jr. Place, 40202. It's downtown Louisville between 6th and 7th. And it's very near to Chestnut, and it's in front of the federal building there, where the offices of Congressman Morgan McGarvey are located. And Congressman McGarvey is one of the supporters of single payer health care. He has signed on to the new bill, which is going to be introduced in the House and the Senate, the improved Medicare for all. It will be introduced on April 29. And so it will be out there so that people across the country will be able to work on getting their senators and representatives to sign on. The National Day of Action has over 70 co-sponsors, which is a good thing. I'm going to try to name some of them so that you get some perspective on it. It's been co-sponsored by the Kentucky Poor People's Campaign and by the Keokuk, Iowa Central Labor Council. It's been co-sponsored by the California Alliance for Retired Americans, which is an organization of about 1 million people. It is the affiliate of the AFL-CIO. The Alliance for Retired Americans has a chapter in most states. And there are a number of physicians for a national health program chapters that have signed on as well. And I can't think of who the others are that are endorsing. Some disability organizations, some state single payer groups, some religious groups, etc. So it is a popular plan to try to put into motion the activity to make this legislation happen.
I'm really excited about this National Day of Action because it's long overdue. I think probably everyone listening to this program has had some experience or knows someone who's had some experience of the crisis that's happening in our current medical system. And those of us who have been involved in this movement know that it just keeps getting worse. And I wanted to speak a little bit about how this bill that's being introduced is going to be better. And we say enhanced Medicare for all. Some people are aware that there's problems in the current Medicare system. And part of that is because of the privatization. It's like a big scam. It's not a welfare. It's not a public well-being. The current system we have is not about public well-being, and our government is becoming it's more about corporate welfare, where our public programs like Medicare and Medicaid are being privatized. So our tax dollars are going to insurance company providers who are denying care. And the way we feel that, I mean, people, whether they have Medicare or Medicaid or private insurance, have seen the rates for premiums and copays and deductibles go up and up. Meanwhile, since 2016, specifically Medicare Advantage plans, they get payment from the Medicare Trust Fund at higher and higher rates almost every year under both Democratic and Republican administrations. And, when the Medicare Advantage rate hikes were announced, President Trump has raised the rate for Medicare Advantage's plans 5.1%. When that was announced, insurance stocks soared. So this is just the profiteering is a big problem in our system. And the physicians out there who are concerned about national health program, I think once they understand that a national health program would free them from corporate control, they would completely be on board. So I'm hoping that everyone comes out to this National Day of Action in Louisville. If someone would like to sponsor a similar event in their own area or organize a bus so we can have busloads of people from all over Kentucky come to Louisville on May 31st, we can let the government know that we want public welfare to be their concern, not profiteering for corporate welfare. And I hope some doctors will see me on May 31st, and we can get the Kentucky chapter for Physicians for a National Health Program growing strong.
The action is so far planned in, I think, at least 9 cities. I'm going to try to name them. I may not be able to do that, but there's one in Portland, Oregon. There's one in Seattle. There's one in Santa Barbara, California, and one in San Francisco, California. There's one in Houston, Texas, one in North Carolina, and I've forgotten the city. I think it's Charlotte, Charlotte, North Carolina. One in Pittsburgh and Pennsylvania, in Western Pennsylvania. And there's our action here in Louisville. And there's one in Arlington, Virginia. And more are on the way because there are sponsors of this event from many, many other cities. And I just heard from someone today in Ithaca, New York, that said she's going to try to plan something there. So it's a growing effort across the country to give visibility and voice to what would truly be the solution to our healthcare crisis. And I think we should talk about that so that people understand, why is it that we have to get the profit out of healthcare? Why is it that our system functions so poorly, that we have just many, many, many excellent physicians and good facilities and lots of research and very good nurses, good hospitals, and yet we have a lowering life expectancy, maybe 5 or 6 years below that of other wealthy nations. And the Commonwealth Fund says that we come in last in terms of the industrialized countries, in terms of our healthcare system. It's not functioning to keep our people healthy. And we have 100 million people that suffer from medical debt. They go into debt in order to pay their medical bills. And that means that many people go without care because of their inability to afford it. So those are some of the reasons why we have to go to a system that the rest of the industrialized world has figured out works, either a national single payer plan or a national health service that would publicly fund healthcare and remove the barriers of cost so that everybody has it available.
I would just like to recap about when we use the term single payer healthcare, and single payer healthcare means that the single payer in this case would be the federal government. But so we really are trying to reframe this as a Medicare for all, enhanced, as Katrina said a little while ago. There's so many different health plans in the industrialized world, and like Kay said, we are the only ones who do not include everybody with an affordable, accessible system. I just got an article today, or that I read, and it was about Australia's system. Australia claims to be a universal healthcare system, but it's really, people are issued a Medicare card. Their system is called Medicare, just like ours, and everybody gets one. But if you examine it, you see that they can really only claim to be a universal healthcare program. Their program actually is much like we have here in the U.S. It's a convoluted mess of public and private, and it just, I was so struck by how it does resemble the system we have now that we're trying to get away from.
I talk to patients every day who are having delays or denials of care. I talk to patients who refuse to go to the emergency room when I've determined that's what they need to do, because they know there's going to be high copays because of their previous experience. One of my recent patients was from the Ukraine, and he talked about how much easier it was for him to access care when he was in the Ukraine than it is here, even though he's working here and is citizening here and insured here. When he was hospitalized in the Ukraine, he got everything covered and then didn't have any debt afterwards. When I was talking, he was refusing to go to the emergency room, back because he had already been to the emergency room and had refused to be hospitalized after a discussion with the insurance company about pre-authorization. He was afraid about the bills he was going to get. And so that wasn't, I mean, that's a problem for him. It's also a problem for his doctors who want to give him good care that, you know, and hospitalize him. But he was refusing because of the insurance company shenanigans.
Well, I'm anxious to see the bill that will be introduced tomorrow. I think there are certain elements that I'm waiting to see. And Katrina, you hit on part of it. And then as the employers really don't want to pay health insurance and they think it's putting them behind the eight ball. And certainly if you're an employee, it restricts your ability to switch jobs. And I think that's a key element to this. And I'm anxious to see, like I said, tomorrow when the elements of this bill come out. And first of all, the employees are paying a higher percentage every year for their health coverage. And it's shared by the employer, who obviously is very much interested in having this burden off of their back. And I think that that's something that often goes under the radar screen when we talk about Medicare for all, enhanced Medicare for all. Let's get the employer out. Let's let single payer health care and Medicare for all cover the employees.
Well, on that note, there was a recent article in the Marietta Daily Journal. And in that article, it was talking about the fact that 22.8% of Georgia's small businesses currently offer health coverage, down from 36.3% in 2009. And what the article said was that as the insurance companies have become more complicated, costs have risen, that the small family-owned business, which has been the backbone for generations of, families to actually have employment, be able to have some kind of, financial growth, that the families can't compete anymore against large corporations to attract and actually retain employees. Whereas the large corporations can kind of go in there, and if they do offer health care, they can get a reduced cost. Whereas these small businesses, it's a killer for them. And because of that, they're unable to offer health care to potential employees, which, a lot of potential employees need health care. They either have themselves potentially a, healthcare issue that needs to be addressed, or they may have a family member and they know that they can't accept a job that does not offer healthcare. So, it's actually crushing small family businesses to not have some kind of a single payer in place, because these small businesses can't hire people and retain them, because they have to go elsewhere where they can get potentially health care coverage.
Well, those are good points, Amber. But there's a lot of information out there that people don't know about, and Kay can shed some light on this. You mentioned there's a discount for the large corporate employees or employers, excuse me, for their employee health insurance, but it's not as large as one might think.
It is far more expensive for a small business. Yeah. Well, and a large number of the corporations just don't want to give up the profit to actually get their employees healthcare coverage. But I do think a lot more of the small businesses would offer it because they're in the community. They want to be, providing their employees these things, but they simply can't afford it. The margins of their profits are much smaller than a giant corporation. And if in fact there was single payer, then these small family businesses would be able to hire people, and that wouldn't become part of the equation of whether or not the people could take the job.
So it would be a boost to the small family-owned businesses
Exactly.
if we could pass,
Yes, it
or when we
absolutely would.
pass national single-payer healthcare, because everyone would be covered, not through their employment,
Exactly.
but just through their humanity, their personhood would entitle them to coverage under this national bill. And you know, it's only right that everybody be covered. My goodness, all of our tax money, a lot of it goes into the research that has provided for, you know, a healthcare system that now knows how to cure many of the things that were once deadly. And we have helped to pay for that research, and we all deserve to have a share in the benefits that come from those medical skills and that research and that understanding and that learning that we've gotten. In terms of employer-based healthcare, I just happened to been reading the figures recently. It costs for family coverage in an employer-sponsored system approximately $25,000 a year. It's a little over that. That's huge. I mean, that's several times what the minimum wage is. If you make minimum wage in this country, you make about $15,000 a year. So this is a huge chunk of the money that could go into other benefits or into pensions or into wages. And instead, that much money is being spent between the employer and the worker for the family health care coverage. I think about 16,000 of that comes from the employer, over 16,000. So there's still a lot of the premium that's paid for by the worker. I don't know the exact figure, maybe 7,000 or 8,000 a year, just in the premium. And that's not the end of it, because when you go to use that coverage, there still can be thousands in deductibles, much in copays. So the system is not sustainable. It is too costly. It is beyond the means of the ordinary person to be able to purchase this insurance or to actually use it with all of the copays and the barriers. And it's a system that benefits the profits of the insurance industry. It does not have any other benefit for us. It's geared around that interest rather than around service to our community. And it's harmful to physicians. Physicians can't prescribe and treat according to their professional wisdom. They instead have to call the insurance company to ask permission to treat a patient in the way that they choose to do so. One of the members of our organization is a physician who said she was unable to get the MRIs, the diagnostic testing that is needed in order to be able to appropriately diagnose and treat a condition. If you can't get that, you can't know what's wrong, and it impedes the ability to have a system that actually serves people. So we're raising that issue on May 31, that we want a healthcare system that, instead of working for profits, works for the health of all of the people and works to give us a system that is sensitive to human need and dignity and integrity, rather than a system that is geared around maximizing the lucrative gain from the system.
It's also a major point of
I think
attention when they are negotiating a new contract with the employers. and it becomes a huge factor in benefits. And it's costing a lot of employees lower salaries because the company will come back and say, oh, our healthcare costs have gone up. That should not be part of the
Yeah.
negotiating process. It's absurd.
Also, Kay, I just want to say that your comment about the deductibles is huge because I don't think most people really think about the fact that when you suddenly, let's say you end up in an emergency room and you have a $5,000 deductible, that means you need to come up with $5,000. And, in a society where now 60% roughly of Americans are living paycheck to paycheck and have a very nominal savings available to them that they can draw on, this is putting people into a situation where they may not, even if they find themselves in a situation where it does get approved, if they can't come up with that deductible, they're not going to take that procedure. They're not going to have that procedure.
Right, Amber, that's a very good point. It means that you have to triage yourself and your children if you don't want to bankrupt your family.
Exactly.
No one should be in that position. We are not
No.
qualified to make those decisions. And it's heartbreaking to know that people go without care, sometimes their decision, rather than to go into debt and to hurt the family income to such an extent that other people are impacted by it.
Just want to chip in here. So when I talk about corporate welfare, a single payer enhanced Medicare for all would also be an ethical form of corporate welfare and well-being, right? I'm against the insurance corporations profiting from our taxpayer dollars and then denying care, but I'm not against the welfare of corporations who also don't want to have to spend such high premiums.
Yeah, but that's what we're all about.
No, I
That's the
think
whole
that's
point
actually
of
a
it.
good point.
Let's
Yeah.
let's get that, like Charlie said, off the backs of the employers.
Mm-hmm.
And
Single
then
payer
everybody.
is an extremely pro-business move. Yeah.
Yes, it is. Yes, it is.
What's best for everyone is best for everyone. How do you say it, Kay?
Everyone.
So,
And it's interesting that if you look at any segment of our healthcare system, they have something to gain from this. Whether if you're on Medicaid, and we all supported Medicaid expansion and we're fighting against the cuts, we should continue to do that. Don't let them cut Medicaid, people will be hurt.
No.
But Medicaid isn't good enough. It pays at a lower rate than the private insurance companies. It makes it difficult for those on Medicaid to be able to find specialists. The system doesn't pay enough to sustain the infrastructure, so we're having difficulty in rural areas sustaining the hospitals if they're dependent on Medicaid. And Medicaid is also privatized, so there are prior authorizations where there's interference by the insurance company between the doctor and the patient, and there are people who don't get what they need. So it's whether it's Medicaid or whether it's Medicare, where we need to have eyeglasses and hearing and long-term care are all left out. Dental is left out, and we have huge copays and deductibles that people pay and people buy who are in traditional Medicare. They have to buy into a Medigap plan or a supplementary plan, all of which is too costly for so many seniors because we don't have good pensions in this country. People live on very modest retirement. And so people on the traditional or Medicare Advantage would gain by single payer. And if you have employer-based healthcare, you gain by being able to get more into your paycheck and get better coverage. And if you're uninsured, you actually finally get coverage. So whichever, or if you buy into the exchanges, which are so expensive, if you buy into the exchange, unless you are very, very low income and have it subsidized, you will pay a lot. And the deductibles are outrageous. They're in the thousands and thousands of dollars in the exchange plan. So there is no part of our healthcare system that really takes the stress out and assures that humanity and the service comes forward, that frees the doctors to practice according to their conscience and their training, that frees people to see doctors and go to that without worrying about the cost. Our system costs twice as much per capita as the systems that actually cover everyone. So we're paying more and getting less. Some people say, well, we can't afford that single payer healthcare. We can't afford not to go to single payer healthcare. 30% of our money goes into administrative waste that is geared around promoting profits. We have to change this.
Just the economies of scale that could be achieved as part of a single payer system are huge. You know, if they were buying in bulk or able to negotiate drugs in bulk, they can get effectively massive amounts of savings. This is why drugs in France cost 4 times less than they do here in the United States. It's why, many drugs in Canada are half the cost of what they are here. It's because the governments can negotiate bulk with the pharmaceutical companies for those products and get them at much cheaper prices. And we could have that too if they would actually have a single payer system.
That's an excellent point, Amber. And that is a part of the single payer legislation, is the ability to negotiate the drug prices and to lower them. I think that they could be lowered to 40% or something like that. I think the VA, the Veterans Administration, does that, and they get their drugs at a much lower cost. So we would lower the cost to the country and we would give the drugs without copay to the people, and it would make available all of the things that people need for to treat whatever they have. You know, our country has come up with, or many countries have, solutions to cancer. Now it is in many cases something that people can survive. And but sometimes people turn down the treatment that has been prescribed because the cost is so great and the drugs are so costly. And we had a person from Louisville who went to MD Anderson, a cancer specialty hospital in Texas, to get treatment. And then when the insurance company said they would not pay for that treatment, that person returned home and died from that cancer because the insurance company did not provide the money that was necessary to provide the treatment that was available. That shouldn't happen. That should not happen. That's a disgrace on the national, on the face of our nation, that we would allow this to happen in a country that cherishes life and freedom and liberty.
And so an enhanced Medicare for all could make our medical system great and put it on par with that of other developed nations instead of being embarrassingly behind on our healthcare statistics. And here in Kentucky, we can't, it's not so easy for us to go across the border to get Canada to get affordable medications.
That's true. It's true.
So I'm hoping that people will come have a voice at the May 31st rally in Louisville, which I just wanted to mention again. And for people who can't make it to Louisville on May 31st, what you can do to have a voice is to contact your state legislators and to ask them to sponsor this bill that is being introduced on April 29th. I'm looking forward to following that bill and seeing the details of it.
Yes, we don't have the bill number yet, but it's being introduced by in the House by Pramila Jayapal and Debbie Dingell, and in the Senate by Bernie Sanders. And we should shortly have a bill number, and we want the whole nation to rise up with the demand that this legislation be enacted into law to end the unnecessary suffering and dying that happens for the lack of a healthcare system that's built around care and humanity.
And I think it could make Kentucky proud if all of our representatives supported this bill.
That's a good idea. And we have five of the people in the House, and the two senators who have not in the past supported this. They need to hear from their constituents, because everybody in Kentucky needs this care. And people in all parts of the state are having these difficulties with finding care at a cost that they can afford.
This is not a radical idea. I mean, every poll taken shows that at least minimum of 60% of Americans are for this. So you can see the stumbling block is in our government, in this corporate welfare that Amber talks about, in supporting the big corporations, along with all the lobbyists and all the money that's spent to persuade our congressmen and women to maintain this status quo, which is bad for all the constituents, but they don't seem to listen to us. So that's why this May 31st movement is so important. If we want this change, it's going to have to come from us upward. Believe me, our government is not going to provide that for us. And every major change that's occurred in the history of our country has been from the same direction. The people demand it, and then it can happen.
You know, we have a history of things being supposedly so, but not really so. We had voting rights ever since the end of the Civil War, when, you know, the Constitution was amended. And yet we had for decades, African Americans were unable to register to vote. And it took a grassroots movement that demanded the justice in order to bring about the reality that should have been all along. Here we're in the same position. I mean, in a democratic society, something that has the support of the majority of people ought to be able to be enacted into law. That's what the Congress is for, to do the things that that serve the public interest and make it a good place to live. And we have to get a force coming up from the grassroots that makes it a demand on every single person. If you're going to sit in the Congress, you need to do something about this healthcare system that is not serving us, and to enact a national single payer plan. So that's what we hope, that the May 31 date will help to focus the attention of the nation on what needs to be done in order to have a better society. And of course, we want to back off all of those terrible cuts that have been coming down the way in the recent months as well. But I think that,
Okay.
yes.
Oh, well, I just wanted to say, I think you made a really good point there, that, you know, 60% of the public actually supports this. And I actually believe that this is less of a political issue, but it's a moral issue. And I think that that's something that can bring people together, or at least I hope it could bring people from both sides of the aisle to view this, that this is a moral issue. And we need to unite and say, for the benefit of our society, just like you said, this is creating a better society for everyone. And I hope that that resonates throughout, you know, this effort.
I certainly agree with that. I know if you think about other things that are in the public interest, you know, it's not enough that my children get an education. If the rest of the people around them don't have an opportunity for an education, what kind of society are my kids going to live in? You know?
Exactly.
This is
Exactly.
something that we need for everyone. And
Yeah.
I think that even the worst of us, if someone was hit by a car in the street, we would not say we should check their health insurance card before we get them the help that they need. I mean, I think if people are faced with it, there is some morality at the base of our society, some decency and goodness there that should resonate in this movement to pass national single payer health care.
Yeah.
We can all be good Samaritans with this
Yes.
program.
Well, the rally for Louisville is set for 11 a.m. at the Mazzoli Federal Building on Saturday, May 31. And we urge you to come out and be with us. We'll have speakers, and I think we'll have some songs by the Raging Grannies. And who knows what else we can put together before then, but we urge you to be a part of it. You can bring your signs and make your voice heard as a part of pushing for what needs to be done to make our society a healthy society and a happier place to be. The other cities are working on it, and hopefully we'll be able to get additional co-sponsors. If your organization hasn't yet co-sponsored, we have some others in Kentucky. The Showing Up for Racial Justice is a co-sponsor. The Greater Louisville Central Labor Council, the Kentucky State AFL-CIO, the Derby City Coalition of Labor Union Women, and indeed the National Coalition of Labor Union Women are all groups that are co-sponsoring this National Day of Action. And your organization can sign on as well. You just go to the kyhealthcare.org. That's our website. And you should be able to find the story about the National Day of Action and the place where your organization can sign on to be a co-sponsor of the national event.
Hey, is there more information available about the event on like Facebook or social media or anything?
I think that it's up on Kentuckians for Single Payer Facebook page. And then National Single Payer also has a Facebook page. I don't know how to tell you to get to it.
Okay.
But the National Single Payer is a website, nationalsinglepayer.com. And then if you click on National Day of Action, you should be able to see the list of 77 co-sponsors, you know, the 9 cities where actions are taking place, some of the songs that people are going to be singing for that date. And the form is available there for organizations to sign on to be a part of it. And the more organizations, the better, the more we let it be known that really the nation is rising up to demand this. All of us, religious groups and healthcare groups and disability groups and all kinds of organizations are wanting to be a part of it.
I'd like to take this opportunity to put out the pitch for people, and including you listeners out there, that this is one point in time in our country's history that we need to all become activists. We need to take part in these demonstrations. We need to take to the streets and let our feelings and be known about what we expect from our government. We are now in what's considered the second golden age of the history of our country. The first was about 100 years ago, and it was the same situation when huge wealthy people controlled everything that the people below them got in terms of benefits and wages and everything else. And we went through a period of the union movement, and the Depression actually helped take the karma of these wealthy people, and that led to great changes being enacted for the people of the country, which actually at that point made America great. So we hear this thing about make America great again. Nobody's really sure when that was. You'll never hear our administration tell you that. They never name a date when it was great, but I can tell you that it was after the union movement. It was after civil rights. It was after Medicare. We were moving in the right direction. And then in the 80s, things changed. And now we're back. We went through this period and corporations and the wealthy now control and rule most of our lives. And it's time that we start this second movement to rectify that situation. Our country's under threat right now. Our democracy's under threat. And like I said, we all need to get out in the street, become activists, and perhaps we can save it.
So we've set up an event to give you an opportunity to take to the streets and express your opinion about healthcare. And that's on Saturday, May 31 at 11 a.m. at the Mazzoli Federal Building. And we hope you'll join us and come and bring your friends and be a part of it. We are indeed in a very difficult time where democracy itself is under attack, and we need to put into motion the democratic forces within our society that can say where the country ought to go and what it should be doing. We live in a time when there's been a declining standard of living. You know, we face a lot of difficulties, whether it's from the environmental changes. I mean, here in Kentucky, you know, we have floods like crazy. And on top of that, we have tornadoes, and they're at an increasing pitch, and that relates to our climate warming. And we need to do something on that. So there are many things where the voices are needed to protect science and research and healthcare. But one of the things that we have solid majority support is to go to a national single payer healthcare system and provide healthcare for everyone. And it could be a new beginning of a moral campaign to ethically and honestly and decently provide for all of the people in the country.
To me, it's just common sense. And I honestly, I think that the insanity of our current medical system has somehow been normalized, and we need to return to common sense. You know, united we stand. I think that once people really clearly look and listen at this issue, that it'll be a unifying issue.
You're right, Katrina. And people should know it's not a matter. I keep saying we can't afford it. Of course we can. We're paying more than any other nation, and we're not getting the care. So if we go to a single payer plan, we divert what's being wasted on administration and wasted on profit making into care, into expanding the care for everyone who has coverage, making their care better, and covering those who don't have any coverage. And so it's not a matter of not being able to afford it. We're already paying for it, and we're just not getting what we're paying for. The money is going into the hands of Humana and Cigna and Aetna and Anthem and United Healthcare and Centene and all of those companies whose stock is riding high because they're making a lot of money, a lot of it from the public programs like Medicare and Medicaid.
And the way that the enhanced Medicare for all benefits private insurance companies is that it helps, it corrects their moral transgression.
Yes. I like how you put that.
That's right, Katrina. It allows them to get out of a business that is rotten at its core because it makes money from the denial of care, and allows them to go and do something better with their lives.
And I think it will be interesting, again, not to beat a dead horse, but to see the elements of the new Medicare, hence enhanced Medicare for all bill. I'm anxious to see that. I think a lot of the reason, as Paul mentioned, it with 60% of the public, I think it's incredibly higher than that. A lot of them are being holding back because they don't understand how it's going to work. You know, the payroll tax and no deductibles, no copays, and it it has to be explained clearly. And Bernie Sanders said that the other day. I saw him on an interview, and he said we hope to be able to lay out exactly how it's going to work. And I think that's essential.
Mm-hmm. Right. And we have to go to the single payer because that's how you save the money. That's how you recoup the funds that are being wasted on administration and profit and put them into care so that there's plenty of money to go around to provide the care that all of us need. And the bills for national single payer, I think they're called Improved Medicare for All, will be introduced on April 29. And following that time, we should be able for everyone to find them and encourage their congressional representatives to sign on and to push for it.
And the reason it's so important for us to sign on and push for it is that the insurance companies are going to be pushing against it. They have a big lobby, so we have to have a citizens lobby.
That's right. That's the truth, Katrina. They'll push against it, but they push against it only in their own interest. They have no argument behind them other than their profits, because all of the things that are barriers to care are things that have been introduced by the insurance companies. They say that we're getting too much care. That's why it's too costly. And they're very wrong. We get less, we see the doctor less than other nations. We are in the hospital less than in other nations. And yet our healthcare costs twice as much as theirs do. So they're on the wrong track when they are trying to cut back and create the barriers. And we have to remove those barriers to care.
Well, and I think too that one of the issues is that the currently insurance companies don't spend a lot of energy and put money into preventative care. I mean, I'm not a healthcare professional myself, but it just seems obvious that if you get a mammogram every single year as a woman over 40, and they can catch your cancer, breast cancer at stage 1, the cost of treatment, as well as the probability that you will have a full recovery, is far greater than if they catch it at stage 4, which is going to be far more expensive to treat and less likely that you're going to survive.
Well, now wait a minute, Amber. That's a very good point, but you don't make money if people don't get sick.
Well, exactly, but that's my point. I mean,
Well, that's right.
these companies are not focused on our well-being. It's all about profit. And, but when you talk about a single payer system, it makes more sense to focus on the well-being of the consumer. And actually, it will reduce the cost because we will catch cancer at stage 1 rather than at stage 4. And I don't know that people really understand that there's a huge cost savings just in that preventative care portion that we would be able to get as a single payer system.
And
Absolutely.
we need to cover all the things that are left out. So many people go without dental care because it's not covered. It's not covered under Medicare, and it's barely covered. It's a little bit covered under Medicaid. But most of the plans that people have don't cover it, or they cover it to such a minimal extent that they'll pull your teeth, but they won't replace them. So, it's terrible that I think, as Paul said, the things above the head, the eyes and the hearing and the dental, are often left out in our system, and also mental health. And all of those are a crucial part of a healthcare system that is really humane.
Well, it's again, I think what you said earlier, Kay, it's really saying a lot about our society. If we are willing to say, well, these people don't deserve a quality of life, but these people do. Not being able to hear your grandchildren, not being able to see, the beauty around you. These are all things that come from denying people care.
I'm wondering if the bill will address the issue of some counties in Kentucky not even having a hospital?
Well, I think single payer legislation provides for the funding for the infrastructure needed to make sure that every part of the country has access to care. Now that's dependent on whether the insurance company does it. And we need for that to be funded so that no matter where you live in this nation, you have an ability to find a physician and a hospital to serve your needs.
You know, I was talking about the Australian healthcare system, who they claim to be a universal healthcare system, but they're so much like the U.S. I was just blown away by that when I started delving into it. That talking about the rural hospitals, they have the same problem. In fact, the article was published because their system is in deep trouble right now, and they're wondering if they can even save it. And it led me to think about our system and what we're trying to do. We're trying to save healthcare for everybody, which that only comes with a true single payer universal program. So we can see that we should resist the people who try to start framing ours as universal with band-aids that don't work in the system, and it gets worse and worse and worse, and it's been on that downward slope for a long, long time.
And we thank you for listening to Single Payer Radio. If you need more information, please go to kyhealthcare.org and join us for the rally at 11 a.m. on Saturday, May 31 at the Mazzoli Federal Building.
This concludes our program for today, so thank you, listeners, for tuning in. Continue to listen to Forward Radio and all that it offers. It's much appreciated. Have a wonderful rest of your day.